AM 1060 WMEL. The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
This is Joe Steckler, folks, your host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. The purpose of our show is to inform, educate, and connect seniors and those that care for seniors to resources. Our phone number for the office is 473-7770, and if you call that number, you'll get Kay Kaiser, our information specialist. I'll give a bunch of sponsors for the first part of the show, actually for the whole darn show, but I'll give half of them to start with, and I'll give another half the second half. That's if I can read my writing, because I forgot my big block printed boop sheet I use. But I'm going to do a sort of from memory. So I'll say the first first sponsors I would include would be the Eye Institute, Spotlight Magazine, Senior Scene Magazine, Ebony News Today, Aldea Today, Hometown News, this radio station, Solid Bite Dental Implant, Barbara McIntyre with Reverse Mortgage. Notice, folks, all that media in there. And today we're going to talk about hometown, our in-home care. But before I do that, I want you to know that there's been a lot said in the newspaper and on radio, and it's been on television too, about the battle we've been waging here to bring resources to helping seniors. Fighting for resources and a state of limited funding is very difficult. A lot of people see new emerging organizations coming on that can do a job better some of the older organizations, and they're reluctant to let go. But I would remind everybody, and I even recognize it at 82, that the world changes. And sometimes we have to let go of what's been going on in the past because there's a newer and a better way to do things. We did a survey of over 400 people in this county from Titusville to Mico, and 17% of those seniors surveyed said one of their greatest needs was for more information. Helping Seniors has a radio show, a television show which airs 18 times a week, columns in the Spanish newspaper, the Black newspaper, Hometown News, Spotlight Magazine, and Senior Scene Magazine, and various columns in Florida Today. There is no other organization doing that. So I ask you to do a little soul searching, because I'm starting a campaign to reach out first to the military and then to people I know and I've known for 25 years. And I'm going to ask them to think about contributing on an annual basis to what we're doing. And I published that in the paper, and some guy came back and said, this provider network that Steckler is trying to think up of doing is simply as an organization to fund people that pay him, he said, $1,000 a year. I can assure you, folks, I did TV shows for Meals on Wheels, no charge. A TV show and publication of the show for Housing for Homeless, no charge. We recommend people from Titusville to Mico that can provide a good, honest service to people. So, think about it. Think about what you want to do. But today I'll introduce my panelists here in the showroom with me. It's the biggest group of panelists I've had for a while. And the subject is in-home care, and I've got Nancy Deardorff, who is a registered nurse, and she's now the clinical director for Maxim Healthcare. Marianne DeBardino, I got it right, Marianne?
Right.
She is a minister to the sick, is an outreach ministry at the Holy Name of Jesus Church, and the reason she's on here is because she's the one that brought up the reason I needed to have this show, because it talks about taking care of people in their home. And the other panelist is Josh. Don't say a word, Josh. I got it written. I got it here someplace. I'm going to get it right. Josh McGreen.
Yes, sir.
Josh McGreen. It's a good Italian name. And Josh is the branch manager for Maxim Healthcare. And I asked him before the show how big Maxim was, and he said they have over 400 locations across the United States.
Yes, sir.
So that's a big organization, and it needs to be big. Healthcare, folks, is something that's we just can't ignore it. First, let's just talk about Josh. You and Nancy can both start talking about what is Maxim. What does it do?
Well, we're a home care agency, so our main goal is to identify the people that need home care and then provide the service at a level that is really unrivaled in our industry.
Nancy, what kind of service? You're a registered nurse, and so is Marianne. She happens to be a registered nurse, and I didn't know that. I've known Marianne. She's been down here in Florida for 2 years now. You were snowbird, now you live here for 2 years, and you are a registered nurse, Marianne. But let Nancy talk about the services that Maxim provides and how that's going to connect as we develop down the show, Nancy.
Well, we provide a wide range of services, and you've heard me talk on the show before where people get confused with home care. So I want to clarify, it's much broader than this, but in a nutshell, there's two types of home care. There's skilled intermittent home care typically provided by your Medicare providers, which specialize in care of the elderly. And typically Medicare is the funding source, although there is a few agencies out there that take insurance. Then there's Maxim and what we do. We provide also a wide range of services. Primarily we specialize in private duty care where we do shift work in someone's home, and our care and services range from that of pediatrics to young adults to middle-aged adults to geriatrics. We accept Medicaid patients, Medicaid waiver patients, commercial insurance, private insurance, long-term care insurance, and, of course, private pay. And the services can range with Maxim from skilled care, from nurses. We have patients that we take care of in the home that are long-term care ventilator patients that may have to be on a vent the rest of their lives in some cases, tracheostomy care. We have pediatrics on the same. So we have a wide range of staff with a wide range of skills. And what we try to do is reach out to the community, educate what we can do, see what the patient needs, and match that specific caregiver, whether it be a certified nursing assistant for non-skilled care or a nurse that specifies in the skill or has the skills necessary to take care of that patient. Usually long-term care with Maxim.
Okay, I want to ask one question before I bring Marianne in. You mentioned you take care of Medicaid patients. Do you accept the statewide Medicaid managed care that's developed through United Healthcare, and there's actually four HMOs that take care of the state of Florida? You have that.
We certainly do. Yep.
And what is, just so that people understand that we're not, everybody thinks that the healthcare business you're making millions.
No.
What is your rate actually from the HMO for providing a person's care?
We're getting onto your topic of passion, which is Medicaid.
Right.
Which, rather than quote our rate, Josh and I will just probably stand as united front on this and say it stinks. So, quite frankly, the truth is out there, and we do our best to care for everybody that needs care, believe me. It's not always about the bottom dollar. We are a business. We need to stay, awake and alive and employ people. But we also do community outreach and help people that need help. But honestly, the Medicaid rate in this state oftentimes doesn't cover the wages of what we would need to pay a nurse to send them out to a patient's case. And we managed to do that pretty well.
Yeah. So you all I can't talk about it, really. I shouldn't have asked a question. I should have made this statement myself. I'm not going to be very far wrong in saying that the HMO gets reimbursed itself roughly $1,400 per client per month. Out of that $1,400, they take a percentage for profit overhead and give some dollars out of that money to what a doctor thinks needs to be provided in service, and that's where you all come in.
Yes.
Okay.
Correct.
Having said that, Marianne, you came here from New York. You're down here. You made a comment to me in the lobby, and I want you to think about that comment for just a minute, but tell the people your background a little bit and why you're so interested in what we're talking about today.
Well, my interest is more from the volunteer aspect. I had the privilege when I lived in New York to be involved with hospice care and home visits through our church. So when I moved down here, I just naturally decided I wanted to continue in those realms, and I've had the privilege to be in many homes in the county. And during my visits, I realized many of our seniors are not only living alone, but they have no support system. Many of them can no longer drive, and the system seems very hard for them to navigate, particularly phone calls when it's difficult to get a human being. Sometimes, for example, last week I made 10 phone calls to find out what services there are for visually impaired, because I see many who perhaps have macular degeneration and really need outreach. And it's hard to go home at night and not have these people close to your heart, because I think there's a lot of fear and anxiety that they live with, especially when there's no family living nearby. So I'd love to see volunteerism expand in Brevard County.
Yeah, and having said what you said, did you know at the time, you know me, but at the time, did you know about calling Helping Seniors? Did you think about that when you were talking about that person with the macular degeneration?
Yes. In fact, I mentioned that to her because I have seen seniors helping seniors in the home, and I have been favorably impressed.
You know, you saw Seniors Helping Seniors, which is an in-home care business. Now I'm talking about Helping Seniors, the organization that you're on the show with today, which is an outreach and media program. Did you didn't know about calling Kay Kaiser at 473-7770 for that kind of service, did you?
No, I did not.
Yeah. And the point I'm trying to make here, folks, is that for 25 years I have spoken at seminars at various churches in this county. A couple of years ago, I spoke with a doctor at an outreach meeting of 300 people of the complete Southern Deanery of the Catholic Church about services, about how to get help. Yet at the same time, we've got Older American Act money coming into this county in terms of millions of dollars, yet the organization doesn't, has no radio show, no TV show, no outreach program, nothing in the paper. This is ridiculous. If we've got the dollars, they're very scarce. So when we have a company like Maxim that focuses on everything but Medicare, and it basically boils down to trying to do the most you can with the least amount of resources available. Am I right or right, Nancy, Josh?
Yeah, you're right. We work with some of the most difficult funding sources in the country right now. You won't find a lot of players in our game for the simple fact that the reimbursement rates are unfortunately unworkable in many occasions.
Yeah, and that's what you encounter, Marianne. When you talked to me on the telephone, you told me about some cases. One of the cases you said here, I got some questions from Marianne. You said, first and foremost is the need to identify those who live alone and they have no support system in place. They have problems with nutrition. We have Meals on Wheels program, but it's not that easy to get Meals on Wheels for people. Have you tried to get Meals on Wheels for people?
Well, it just so happens my daughter-in-law is involved in the program, but I do find that none of these systems are easy to navigate for those who are living alone. They really need an advocate to assist them, to make the proper phone call and to follow up.
Yeah. So Nancy, enter now. Here you are with a home health care business. You happen to be on the board of Helping Seniors. You're aware of the problems that we have with the media outreach and trying to find funding to get people involved, because actually people, they say to me, Joe, you just get a grant someplace. Folks, I want to tell you right now, out of all the charity work done in the United States of America, less than 7% of that is funded by philanthropy. Less than 7%. So how do you do it? You go out, you get people, you have what you call an annual fund. You try to make people understand that what you're doing is extremely important, and if a lot of people give a little bit, then we make a lot happen. You build endowments that are honest, and you take the money off of the endowment, and you use it to help people. And folks, right now, I'm waiting for the piece of paper to come back where a lady is giving us a 1992 XJS V12 Jaguar Ruby Red, pristine condition, and we're going to raffle that rascal off at $25 a ticket, and all that money is going to go into a fund to help seniors. That will help do some of the things that Maxim does, and it'll help meet some of the needs that you're identifying, Marianne. Why do you get
Correct.
excited about doing something like it you do, Marianne?
I think that I was just born blessed. I feel it's a responsibility. I have had much good fortune in my life, and I feel that our Creator has put us here to care for those who have not been as blessed.
I can't argue with a thing there. Now, Josh, as a branch manager for a company like Maxim, how do you see, or do you see, and you've already answered part of the question, because it's obvious to me that Maxim, through what Nancy does as a clinical director and you as a branch manager, are figuring out ways how you can help people that can't afford to pay for it. I know that you all do this. So, but Maxim, in order to stay in business, has to develop a profit. So people have to pay.
Correct.
So what do you think, and what have you seen, and how long have you been involved with nonprofit work?
Well, prior to joining Maxim, I was involved with a smaller 501c3 in Collier County. We were called Collier Harvest, and our main focus was on feeding hungry people. Didn't matter whether you didn't have to show ID or anything like that. It was, you were hungry, we provided you a meal or dry food, anything really that we had that people needed.
Yeah, and churches do that here.
Sure.
What happens?
Similar.
What do they do at Holy Name?
Holy Name has St. Vincent de Paul, and they're open 6 days a week. They give out food, and then they also give out vouchers for clothing from the thrift shop, and they also help with utilities. It's all on an individual basis.
No, but people keep giving and giving and giving to that. On the other hand, at the county meeting of the county commissioners on Tuesday, when we were denied our protest about the way that the process is handled for funding nonprofit organizations, the way funding is awarded, that part really didn't come out. That one of the commissioners, Commissioner Fisher, said a lot of people don't realize that charitable work, nonprofit organizations, are our first line of defense. And if we take the money away from these charitable organizations and put it, say, into paving roads, the $500,000 that they currently give out of a budget of $1.1 billion, folks, it's a drop in the bucket compared to what is prevented by that very small amount of money. Nancy, and we've got 2 minutes till the break, but how about you talking to our listeners about what you've seen about the capability of organizations like Maxim and your work as a charity person to sort of fill in the gap and help people get through the problems that we're talking about today?
Well, the first thing that comes to mind when thinking about HSOBC is getting the word out, because, how do you know what you don't know? So we have to figure out, we're on the radio, we're in the newspaper, on TV, but unless people are watching or listening or reading, so a better way to get that information out, because knowledge is power, right?
Right.
The second thing that I would say is I'm a big believer in you got to spend a little to make a little. So on your note, giving to a nonprofit like HSOBC would save so much in the long run if people would see fit to give. But we got to get that word out a little bit better.
Oh, I think, we've applied for United Way funding. What people don't know is that United Way is sort of a closed loop.
Right.
If you're not already getting money from United Way, you're not going to break into it. We're trying. I've got a guy lined up. It's the head of the honor flight, and I'm going to meet with them. He wants to talk to me. He's been trying to get United Way funding. He hasn't been able to do it. These are people who served veterans that fought and gave their lives in World War II and Korea. I missed World War II, but I started in Korea. So I'm entitled to everything they are. But I don't feel right accepting it because I know that there's more that we can do. So I just think we all need to do a better job of seeing how we can be involved. And folks, like if you give your money to the United Way, designate what you give to, say, helping seniors. If you designate it to helping seniors, then United Way is required to give that money. So we have a lot of small businesses that give thousands and thousands of dollars to United Way. Heck, designate some of that money for helping seniors.
In our own county.
Pardon?
In our own county.
Exactly right. I forgot to mention about $1 million out of that designated money that they raise every year goes outside of the state of Florida. Or it goes outside of Broward County. I want to make it correct. Goes outside of Broward County. But people don't know that. Again, like you say, knowledge is power. And the more knowledge we have, the better job we're going to do of helping people that Marianne identifies and the people she can help. It's time we're going to take a break, folks. Stay with us. We'll try to stick with services and what these people do so you get a better job of how you can help people help themselves on the second half of the show. Talk to you later. Bye. Stay with us.
AM 1060 WMEL.
This is Joe Steckler, folks. We're back live for the second half of the show. I assure you, I'm going to talk less. That's right, Terry. I promise I will talk less on the second half of the show. But I do have to introduce my sponsors. My sponsors for this part of the show include Levin Home Healthcare, Bill Johnson Elbow Attorney, Seniors Helping Seniors, Peaceful Beach Mediation, Gentiva Home Healthcare, Solid Bite Dental Implants, Barbara McIntyre from Reverse Mortgage, and this radio station, WMEL AM 1060. Kay Kaiser is our information specialist. Kay is listening to the show today. By the way, we're looking for a new office, folks, so if anybody's got office space, you can always call me at 473-7770 if you've got a place we can put our shingle out for, because the place we're at, we got kicked out. Yeah, we actually got kicked out. So that's the best way to say it. I don't try to mince words, Tell it like it really is, because that's part of our system. We have a problem with our system today. We just don't tell it like it really is. But Kay's number is 473-7770, 473-7770, and tell her what your problem is. I know now that Marianne DeBardino, one of our guests, has got Kay's number, and with some of the stuff that Marianne sees as she makes her home visits as a volunteer minister, I'm sure she's going to call Kay to help get people connected up with services. And that's the purpose of the show today. My other panelists are Nancy Deardorff, registered nurse, clinical director from Maxim Home Healthcare, Josh McGreen from Maxim Home Healthcare. Josh is the branch manager, and Marianne DeBardino, who is a volunteer at Holy Name of Jesus Catholic Church. And for those of you listening, I'm not particularly doing it just because it's Holy Name Church. If somebody else has got a volunteer program that wants to be on the radio show, call me at 473-7770. I'll listen to anybody as long as they're willing to listen to me. And we try to arrive at something. And one of my guests, Dr. Lee Sheldon, he is the hardest one I have to convince that other people need to talk to. He even tries to talk more than I do. Right, Nancy?
I'm pleading the fifth.
Yeah, you don't have to be diplomatic.
I love you, Dr. Sheldon.
That's diplomatic. But Dr. Lee Sheldon is one of the longest proponents of helping seniors in this county. He has been with me on radio now for over 10 years, television. In fact, I first started in television on his television show many, many, many years ago.
And brilliant. He could be a life coach.
Yes,
yeah.
He is.
Yeah.
He's a super, super person. And if you want a dental implant, I can tell you, I will recommend him because he put 3 teeth in my mouth, and I've never. They feel more natural. They're still there. Yes, they are, Josh.
Perfect.
Yeah, they're there. I'm not going to let you hit them. You can't hit them. But let's get back seriously, folks. What you don't hear is our break talk, and Josh brought up a couple of points during the break, and maybe you can remember what you were talking about on.
Sure. We were talking about some of those earlier in the show. We were talking about the managed Medicaid plans because we said Maxim is we're able to work with those providers. One of the big hang-ups with those managed Medicaid plans is that unfortunately the services that a lot of our seniors are looking for, such as rides to the grocery store so they can get basic stuff, rides to a doctor's appointment, picking up their prescriptions, those kind of services, they're not covered by these managed Medicaid plans. So although a lot of our seniors do meet the requirements to be under that managed Medicaid plan, the services that ultimately they're looking for will not be covered under that plan.
So then enter programs like, and Mary Ann brought up a program called Seniors Helping Seniors. Do you know enough to tell the listeners what Seniors Helping Seniors do, Mary Ann?
Yes. Recently, I was in a home, and the woman living there is frail, but able to live at home with a little help. And I had the privilege to meet one of the people who is employed by Seniors Helping Seniors, and in no time at all, they had developed a beautiful relationship. And this woman just looks forward to her senior coming in and helping her every week clean and just some of the activities of daily living. And even though it's only 2 hours a week, it seems to be just what she needs right now to maintain living at home.
Nancy, how about explaining to our listeners what ADL's activities of daily living are, why it's important for people to understand it, and how Maxim can do some of those, but Seniors Helping Seniors can do others, and it's important for people to understand where to go for the type of service needed. How about you talk about that for a few minutes?
Pretty much every standard or regulation is there for a reason, but a lot of times we get in our own way. And for every rule, there's usually a reason that a rule was put into place. But ADLs, IADLs are two of the greatest things that our seniors are in need of. To Josh's point earlier, ADLs stand for Activities of Daily Living. IADLs stand for Instrumental Dailies of Activity Living. ADL's example would be bathing, showering, bathing, whether it's in the sink, shower, a bath, grooming, putting on your clothes, upper body clothes, lower body clothes, putting on your shoes, things that we take for granted because we do it automatically. IADL's, Instrumentals, Activities of Daily Living, a big example would be cooking, or at least if you don't cook, being able to reheat or prepare some sort of meal, even if it's a sandwich. Those are the kind of things that payers often don't pay for, that Josh was alluding to, that really is the largest, some of the biggest need I've seen as a nurse. And by the way, before I was in management, I was in the home. We were talking about that on break. And this is really what our senior population is in need of. Incontinent care, as unpleasant of a subject as it is, I mean, just the ability for somebody to keep themselves clean, the availability and the expense of diapers, the ability to toilet, just to get up from a chair in front of the TV and go to the bathroom, and or change themselves and maintain hygiene, going out to get groceries or banking or pick up an antibiotic. The other thing I want to point out is it's important when folks are looking for help, obviously they need to have the knowledge of who to call, and you don't always have to know exactly who to call. I mean, a lot of you in the community have known me for years. If you call Maxim and you talk to me and we can't help you, I'm going to lead you to a community resource that can help you. It doesn't have to. If you don't know who to call me at Maxim. It doesn't matter if we're the agency that can help you or not. But it's also important that people understand when they're looking for services, there's different type of services. Seniors Helping Seniors is an awesome concept because it is senior people helping senior folks. So they get somebody within their generation or their age range, which is companionship. And socialization is huge with our elderly. They lack that. There's a lot of depression that happens in geriatrics and in the elderly senior population. Some of that's chemical. Some of that is due to isolation because they can't get out for those things like rides or do the normal social things they used to do. Some agencies don't do any hands-on care. That's important to note. They are companions. They're there to prepare a meal, to talk with the person. Some agencies provide transportation to and from doctor's office, grocery shopping. Other agencies do hands-on care, which Maxim does, where we're providing. And you have to be trained to do that. We can't take a person off the street and say, here, go, touch this person. They have to be trained. So usually it's what Maxim does is for our unskilled care, they're still somewhat skilled in that they've gone through school to be able to walk a person, which sounds fairly simple, but we have to be trained to what to do in emergency. If somebody goes to fall, how do we break that fall? Yes. So there's a wide variety from literally not touching the patient, where it's not allowed. You just are there for meals, to ADL and IADL care, to skilled care, like tracheostomies, ventilation, Foley catheter care, etc.
Now let's pick up on something that Marianne brought up. Seniors helping seniors. They provide service in $16.50 an hour in a block of 2 hours, $33. I had the owner of the company on a couple of radio shows and on TV. They had a lady that wanted to live at home. She was capable of living at home, but she needed help. And it started out where they went in for 2 hours in the morning, got her up, got her dressed, helped her get dressed, helped her get her food, got her pills ready. And for a year or so, they did that every day of the week, and it cost us something like $1,000 a year. Every day of the week. It came to the point where they needed the same kind of help at night. So they did the same thing at night, put her to bed. $2,000 a month. The woman stayed in her own home.
And what's a skilled nursing facility per month?
Just a 2-bed minimum.
Not an ALF, a
ALF.
SNF, semi-private.
You're looking at $3,000 a month. And the families, they might be able to get into the statewide managed care business, get them to help them a little bit. They might get $800 a month out of them. They might get put their Social Security in it, and they end up with $50 a month out of their Social Security. And then they got to find the rest of the money. Maybe the family can kick in. They come up with roughly $3,000. That's just for the low-end care. To get the higher-end care, it's $6,000 a month. Get into a nursing home, you're talking $9,000 a month. And that's where we're messing with the system so much, because the people that can't afford what we've been talking about on the low end, they're forced into a nursing home because the nursing home can't turn them down. If they're on Medicaid, you can't turn them down. So we need to figure out how we can do this whole thing better. And for the county commissioners to make a statement that we want to be out of the care business of helping charitable organizations, it doesn't make sense, because nonprofit organizations managed correctly can do an awful lot to help people. Now, having said that, we have a wonderful Meals on Wheels program in the county. However, there are waiting lists. There are areas they don't serve. So if you get up in an area they don't serve, if you're on a waiting list and you can't get a meal, how in the heck are you going to eat if you can't get out of bed to take care of yourself? And we have people that call the state number that are waiting 2, 3, and 4 weeks. And folks, I'm not talking out of my hat. It's documented proof. And so we need it. Marianne, you're shaking your head. Why are you shaking your head? And no, you're nodding your head. It's not up and down, shake us back and forth. You're nodding. Why?
I'm nodding my head because I am well aware of what you're saying, and I'm just backing that up, that there are waiting lists for these individuals. And, how do we say no when it's basic nutrition? But I've read about it, and I'm very aware that this is a fact.
Yeah. And this is quite different. You made a comment to me in the lobby of the station today. You said you came down here from New York. You came from one of the poorest counties in New York, and that poorest county in New York had more to provide for senior citizens than this county here that we're talking about today.
That's right, Joe. I have to say I am somewhat shocked down here. I just assumed that a more populated area would have increased services.
Yep.
I came from Allegheny County in New York State, the poorest county in the state, and the services, I have to say, they were plentiful.
Yep.
And the nonprofits as well. We had a home with one paid person that for those terminally ill, people who had 3 months or less to live, and it was run strictly by volunteers and one paid person. And it was awesome because it really brought our town together.
Yep. All right, I said I was going to talk about it. I got to say this. Many of you have been watching the presidential debates. Do any of my panelists remember John Kasich, the governor of Ohio, saying, we take care of our people here in Ohio? Well, let me tell you how he does it. I had a lady, Janice Steiner, sent me a link about the way certain counties in the state of Ohio levy themselves to provide tax dollars to go into a senior care program. That is how they're doing it. It's not where they're dumping it back on government to do it, but they're making it possible for the citizens to take care of themselves. And that's one of the reasons why the Older American Act was put in place in the first place by President Lyndon Johnson. It is an entitlement program, but you got to understand how the darn thing works. Without Social Security, a lot of the women that we get calling us for help, they can't live on their $800 a month. Invariably, and Nancy, you know this, we find out that these ladies are eligible for aid and attendance from the federal government, which is a legal program. It gives them an extra $1,300 or $1,400 a month to live, and they're not dependent on anybody. They can pay their own way. The objective of the whole care system is to figure out how we can get care to people, how the businesses can stay in businesses, and how people can live. And Jancy and Josh, how about we've got 6 minutes left, but I'd like for both of you to talk a little bit about what Maxim does to do what I'm talking about. Your call.
You want to take it, Josh?
Go ahead, Josh.
How do we provide services for the people that otherwise could? How are we able to provide services for folks that are unable to?
Yeah. Just how do you and Nancy work together? Do you talk? I know Nancy's new to the company. I don't know how new you are to the company, but what do you see? You're a branch manager. You see exactly what
I do
Marianne is doing. What do you think can be done in the future to help people?
I most definitely think that one thing that we haven't brought up yet that I would like to is the transitional care program. Really, that.
What is the transitional care program?
It's kind of a byproduct of everything we've just talked about. Of people, not just seniors, but people not being connected to the care that they need and not knowing where to go or how to go to find the resources that they need. So what a transitional care program does is it identifies high-risk individuals who are most likely going to, in the future, have a
problem?
Yeah, have a problem, any problem. And it connects them with a community health care worker who is licensed and went to school for their certificate. And this community health care worker follows up with them. Hey, you had a doctor's appointment yesterday. How did it go? Did you get a new prescription? I'd love to take you to the pharmacy to make sure you have it, you know. It connects people with a resource like that a person dedicated strictly to them to make sure that they're receiving the kind of care that they're entitled to, that they need.
For those who are,
Nancy,
yeah.
isn't Kay Kaiser doing that same thing for 700 or 800 people?
She is, and yeah, she is in her own way. But this is like connecting somebody who's been discharged from a hospital or an inpatient facility, because it's shown that the most vulnerable are newly discharged. Medication regimens change, and rehospitalization is very expensive. So it's geared towards the most vulnerable. So again, yeah, she's absolutely doing that in theory. But that's the biggest problem we have is people not knowing what to do once they get out of the hospital. I can't tell you how many times I've admitted a patient from the hospital going, I have no idea what medications I should take and what I shouldn't, and they end up back in the hospital for medication errors because they're double dosing, because there's two meds that are the same, that are, one's a generic name, they have different doctors ordering the same thing or different doses, or they skip doses, or they continue their old medication and start new ones, for the same purpose. So that's what Josh is talking about, dealing with the vulnerable, high risk for rehospitalization.
How close is that to really being?
It's happening. It's already happening.
Okay. Where? But it's not. Is it happening in Florida?
Yeah, it's happening. It's happening in Brevard.
Who's doing it in Brevard? Are you all doing it?
A lot of the home health agencies have instituted their own. Not necessarily funded separately by the federal government, but started their own.
Okay.
A lot of your Gentiva, where I came from, is doing it. They have a transitional case manager, and that's what they do. Their job is to follow a patient from the moment they're before they're discharged out of the hospital, for so many days after they're reinitiated to the community in their home. Make sure they're stable.
And how's that paid for? Who pays for that? The agency? Comes out of high.
For a Medicare home health agency, it's Medicare. It comes out of whatever the Medicare. There's not a separate payment for it. So you have to, and I'm going to answer. I don't know how much longer we have.
You've got 2 minutes.
Okay, plenty. Because I want to say something on the cusp of what you asked and what Josh said is to answer that first question is folks like Gentiva and other Medicare agencies that have, and a lot of them have, hospices have even done that. Transitional case managers is paid for by the grace of that company who's willing to pay that person a salary based on what they get paid from the government. They're getting no more money. In fact, they're making less to create that job.
Okay.
And as far as Maxim, how do we do it? How do we reach out to the underprivileged? How are we able to accept Medicaid? And we get a lot of Medicaid referrals. Why? There's not a lot of people in Brevard County that take Medicaid. I can tell you that right now.
I know it already.
Coming from the non-Medicaid world most recently into the Medicaid world. So thank God for Maxim and companies like Maxim. And how do we do it? I'll tell you what. This is what people don't think of. One of my favorite quotes is from Eleanor Roosevelt, who once said, there is nothing more unequal than the equal treatment of unequals. Okay, and you see, if you're on Facebook, you see posts about people on welfare and people resenting it and all this. We have to have a form of that if we're to be a healthy society, okay, which is what our taxes are for, which is why we give to FICA in our payroll. 1 minute. So how Maxim does it is anytime a service is provided by somebody, it's provided by someone, except for volunteers, right? It's paid for somebody who gets a salary. So you get somebody who's passionate about what they do. You get a Josh, you get a me, and you get our caregivers that are willing to accept pay that's less than some other companies out there. That's how it's done.
That's how it's done. Folks, I hope that whoever wrote the columns in the papers that said that the provider network we wanted to set up doesn't talk about somebody else. You've seen your argument refuted on this show today. So just pay attention to what's happening. Marianne, I want to thank you for what you brought to the show today. I thank you, Josh. Thank you, as always, do, Nancy. It's always a pleasure to have you. I'll have you all back. I think we can have another show. Thank you all for listening. And listen, by the way, happy Thanksgiving. There's the day of football that day. I'll be home watching football, but I'll be thinking about you, and I'll keep you in my prayers at my Thanksgiving Day Mass. Thank you, and bye-bye.